Mental health and substance use disorders pose significant challenges to health, well-being, and achievement of life goals, such as education, employment, and financial independence. At Mathematica, we use our specialized knowledge of behavioral health service systems and data analytic methods to help state and federal agencies develop and implement effective policies and programs to improve behavioral health outcomes. We're currently evaluating the Primary and Behavioral Healthcare Integration Program for the Substance Abuse and Mental Health Services Administration. This is the largest single federal effort to co-locate primary care services in community mental health centers. Our cross-site evaluation is examining how the program is implemented and its impact on reducing chronic conditions, including diabetes and hypertension, which often occur simultaneously among individuals with serious mental illness. This work builds on our previous projects that have examined how states and health plans coordinate behavioral and physical health care services. From these projects, we've identified some of the key elements of successful integration, including the use of new technologies to share information across providers and keep consumers engaged in care. We're also working to help stakeholders identify strategies to help sustain these integration efforts.
In 2014, more people died from drug overdoses than any other year on record. Today, there are more deaths from drug overdoses than deaths resulting from car crashes or gunshots. The spike in overdose deaths is driven by prescription opioids, which are powerful narcotic painkillers prescribed by doctors that, if misused, can pose serious risk for abuse, addiction, overdose, and death. Both the amount of prescription painkillers dispensed and the number of deaths resulting from their misuse have nearly quadrupled since 1999. Mathematica is addressing the opioid epidemic in several ways. First, we are helping to establish standards to examine the effectiveness of the Department of Health and Human Services Comprehensive Opioid Initiative. Second, we are evaluating a pilot intervention to assess how changing defaults in electronic health records impacts opioid prescribing practices. Information from the evaluation could inform policies and decisions to reduce inappropriate opioid use. Third, we are helping HHS develop quality measures that can be used to assess the delivery and effectiveness of evidence-based care for people with opioid addictions.
Over the past 15 years, the steady rise in the U.S. suicide rate has highlighted the challenges of ensuring that people experiencing psychiatric crises get help before it's too late. Many stakeholders, including psychiatric hospital associations, state behavioral health commissioners, and General Hospital Emergency Department personnel, have noted challenges in finding inpatient beds for Medicaid beneficiaries experiencing psychiatric emergencies because Medicaid does not pay for inpatient stays in large standalone psychiatric hospitals. To test the effects of relaxing this Medicaid restriction, Mathematica is evaluating a demonstration in which 11 states and the District of Columbia receive federal matching funds for inpatient treatment in private psychiatric hospitals for adult beneficiaries who are suicidal, homicidal, or otherwise dangerous to themselves or others. Our evaluation results will provide important information about the effects of the demonstration on access to inpatient care, lengths of inpatient stays, emergency room visits, and overall cost to Medicaid of the full range of mental health services.
Along with our partners, including the National Committee for Quality Assurance, we've worked with multiple federal agencies to develop measures to assess the quality of publicly funded behavioral health services. These measures include assessment of care coordination across multiple providers, follow-up after hospital discharge, and the delivery of evidence-based psychotherapies. To help ensure that the measures help increase accountability and improve care, while also minimizing the burden of data collection, these measures draw on data from a range of sources, including electronic health records, insurance claims, surveys, and other sources. Many of the measures we've developed have been endorsed by the National Quality Forum and are used in national reporting programs.
Mathematica is proud to make important contributions to the evidence base in behavioral health care. To learn more about our work and the people behind it, please visit our website.